Next, let's discuss certain types of activities considered unsafe for pregnant women. Contact sports such as basketball, ice hockey, and soccer should be avoided due to the high risk of abdominal trauma. Activities with a high fall risk like downhill skiing, gymnastics, and horseback riding are also off limits. Scuba diving poses risks due to changes in pressure, and hot yoga should be avoided to prevent dehydration and decreased placental perfusion. Now, let's talk about the conditions where exercise should be approached with caution. If you're at high risk for preterm birth due to cervical insufficiency or have a cerclage in place, exercise should be minimized. Similarly, if you've experienced preterm labor in your current pregnancy or have had a preterm pre-labor rupture of membranes, it's best to avoid physical exertion. For those at risk of antepartum bleeding, such as with placenta previa, or persistent second or third trimester bleeding, exercise should be avoided to prevent exacerbating the condition. Underlying medical conditions can also dictate exercise limitations. Severe anemia, hypertensive disorders of pregnancy like preeclampsia, restrictive lung disease, and hemodynamically significant heart disease are all contraindications for exercise during pregnancy. These conditions can be worsened by physical activity, making it important to consult with a healthcare provider before continuing or starting an exercise regimen. While many activities should be avoided, jogging can often be continued as it carries a low risk of falling and dehydration. If jogging was part of your routine before pregnancy and you feel comfortable, you may be able to continue. However, always listen to your body and consult your healthcare provider. Low-impact activities such as walking and swimming are generally safe and beneficial throughout pregnancy. It's essential to monitor for any signs that indicate the need to stop exercising and seek medical evaluation. If you experience vaginal bleeding, leakage of fluid, contractions, or chest pain, stop exercising immediately and contact your healthcare provider. To illustrate these points, let's look at a real-life case study. Sarah, a 32-year-old woman in her second trimester, was an avid runner before pregnancy. When she found out she was expecting, she wanted to continue her routine to stay fit. During her prenatal visit, she discussed her exercise habits with her obstetrician, who confirmed her pregnancy was uncomplicated. Sarah was advised to continue her moderate intensity exercise, jogging for 20 to 30 minutes most days, but to avoid high-risk activities like trail running on uneven terrain. She also stayed away from hot yoga classes she used to attend. Sarah listened to her body, adjusted her pace, and stayed hydrated. At one point, she experienced some mild contractions and immediately stopped her run to rest and hydrate, which resolved the issue. Her careful approach allowed her to maintain her fitness and well-being throughout her pregnancy, leading to a healthy delivery and quick postpartum recovery. In conclusion, exercise during pregnancy is highly beneficial for most women, contributing to both physical and mental health. However, it's essential to avoid certain high-risk activities and be aware of contraindications to ensure a safe and healthy pregnancy journey. Always consult with your healthcare provider to tailor your exercise regimen to your specific needs and circumstances. That's all for today's episode of Med Madness. Stay tuned for more discussions on maintaining health and wellness through various life stages. If you have any questions or comments, feel free to reach out. Until next time, stay active, stay healthy, and take care.